Hi, my name is Brian Kim, professor and vice chair of research in dermatology, director of the Mark Lovell Center for Neuroinflammation and Sensation at Icahn School of Medicine at Mount Sinai.
Vignette 7, Hives versus Itch, the role of type 2 inflammation in itch in CSU. Chronic spontaneous urticaria, or CSU, is a chronic inflammatory disease characterized by wheals, otherwise known as hives, with or without angioedema, that recur for more than 6 weeks and may be idiopathic in nature. In contrast to eczematous epidermal lesions in atopic dermatitis and papulonodular lesions in prurigo nodularis, CSU wheals are characterized by dermal edema and are transient, lasting over hours, leaving no pathological evidence in the trail. The unpredictable occurrences of these signs and their associated itch, burning, and pain have significant impact on patients' quality of life, including sleep and daily activities. Similar to AD and PN, CSU's pathogenesis involves specific interactions between type 2 inflammatory cells and signals skin tissue and sensory neurons, resulting in the characteristic signs and symptoms we'll review ahead. However, the combination of timing, compartment, cells, and peritinogens may differ in CSU compared to AD and PN, despite many of these conditions falling under the type 2 inflammation umbrella. The pathophysiology of CSU is not well understood, but mast cell activation, degranulation, and the release of histamine and other mast cell products appear central to the process. In addition to mast cells, wheal sites are infiltrated by monocytes with a predominance of type 2 lymphocytes, basophils, and eosinophils. The signals that activate mast cells in urticaria are diverse and include cell surface IgE, IgE activating autoantibodies, anti-Fc epsilon receptor IgG autoantibodies, T cell driven cytokines, cationic peptides, and neuropeptides, meaning activation can be initiated through both IgE dependent and independent pathways. In IgE dependent mast cell activation, IgE binds high affinity Fc epsilon receptor on mast cells and is cross-linked by antigens or IgG, triggering degranulation. Additionally, cytokines such as IL-4 and IL-13, which are released from inflammatory cells recruited to the dermis, may contribute to mast cell degranulation by increasing expression of Fc epsilon receptor, in addition to other molecules that drive mast cell activation through various receptors and signaling pathways. In CSU, mast cells are also likely activated by several endogenous peptides, including substance P and eosinophil-derived peptides that bind MRGPRX2 receptors on the cell surface. Moreover, MRGPRX2, which is closely implicated in the CSU neuroimmune axis, responds to numerous endogenous ligands, sensory neuron-derived peptides, and even exogenous drugs that induce mast cell activation. Collectively, this pathway represents a diverse mechanism by which IgE-independent mast cell activation occurs and may explain how CSU occurs spontaneously even during IgE blockade. While CSU may be thought as a mast cell-driven disease, basophils, like mast cells, also express Fc epsilon receptor, and growing evidence suggests their degranulation also plays an important role in CSU inflammation and itch. Additionally, albeit controversial, there is evidence to suggest that basophils may also express MRGPRX2 and thus have non-canonical modes of activation. Mast cells and basophils each release histamine, which binds the H1 and H4 receptors on sensory neurons to stimulate acute itch. Histamine also binds these receptors on endothelial cells, contributing to vasodilation and vascular permeability, promoting erythema and edema by recruiting additional immune cells, including basophils, eosinophils, neutrophils, and Th2 cells. The release of substance P from activated sensory neurons may also contribute to vasodilation. Additionally, histamine binding H4R on eosinophils enhances eosinophil adhesion, molecule expression, increasing migration and mast cell activation. Though histamine is a major component of urticarial itch, Antihistamine treatments may not provide adequate efficacy in all patients, indicating that non-histaminergic itch pathways are also important in CSU. For instance, the release of leukotrienes such as LTB4 and LTC4 upon activation act as potent mediators of vascular permeability via interactions with endothelial cells and also bind sensory neurons, directly contributing to itch. In addition, alarmin cytokine IL-33 is highly expressed in CSU lesions and makes the mast cell more receptive to IgE, thereby promoting disease chronicity. Other factors such as tryptase produced by mast cells can also trigger itch via molecules such as PAR2 on sensory neurons. Mast cells and basophils also produce IL-4 and IL-13, which along with IL-31 act on neurons to amplify itch sensitization and growth. Additionally, IL-4 and IL-13 contribute to type 2 inflammation by supporting immune cell recruitment to the dermis, contributing to chronicity. To conclude, mast cell activation plays a central role in CSU's pathogenesis, and although it has traditionally been considered an IgE-mediated disease, growing evidence indicates important roles for IgE-independent pathways as well, such as IgG autoantibodies. Regardless of the mechanism, type 2 inflammation drives classical B-cell activation and IgE production and also amplifies newly recognized mast cell activation pathways, shedding new light on the ways itch and neuroinflammation occur in CSU. The combination of classical histaminergic and more recently recognized non-histaminergic itches arising in the dermis help distinguish the itch, burning, and pain in CSU from AD and PN.